Good morning, friends. Today, I will show you the some questions we will discuss from the Handbook of the Australian Medical Council, and in this we will go through the cases from the dermatology. So, those of you who have gone through the previous pictures and images from my past videos, definitely they will give the correct answer of these questions. That was the reason I gave you the previous video so you can go through all these pictures and images which have been taken from the Australian Medical Council handbook. So we will go through this topic, that's dermatology. I would suggest you, if you can open, if you can see, this is the 3.001, and the lesion shown has been present for 6 months on the face of a 50-year-old farmer. Which one of the following is the most likely diagnosis? So this picture I already show in my previous video, but from here you can see the questions what they are asking. If you remember, definitely you will give the correct answer. That what here he is asking, which one of the following is the most likely diagnosis? Only asking about the diagnosis, giving this picture. So once you have seen this picture, definitely you will give the correct answer. So their options are implantation dermoid cyst. Is it implantation of dermoid cyst? Number two is basal cell carcinoma. C is amelanotic malignant melanoma. D is external angular dermoid. E is keratocanthoma. So you can give the answer that what this image, what this picture is showing. So answer is basal cell carcinoma. This is nodular type of the basal cell carcinoma, which I already showed you in the previous video. Our next question is 3.002. The lesion, they have given this picture, lesion shown has been present on the foot of this 38-year-old farmer for 3 months. They have given this picture asking which one of the following is the most likely diagnosis. Here again asking about the diagnosis. So if you have seen this, if you have watched this, my previous video and this picture, then definitely you will give the correct answer from these options. A. Malignant melanoma. B. Neuropathic ulcer. C. Infection with Burkholderia pseudomyeli. D is necrotizing fasciitis. E. Erythema ab igni, pigmentation from heat. So which option is correct? Definitely, if you have gone through the previous pictures, you will give the correct answer. So correct answer is malignant melanoma. Our next picture, a 60-year-old woman present with a pigmented skin lesion on her leg, as shown here, which has grown in size over 3 months and has occasionally bled when she scratched it. You arrange excision which confirm the diagnosis of 0.3 mm thickness. As already I discussed in last video, that whenever the this type of picture comes, you have to, as I already discussed regarding melanoma, that pigmentation, you have to keep in your mind the A, B, C, D, E. So then definitely you will give the answer correctly. So here you arrange excision which confirm the diagnosis of 0.3 mm thickness, malignant melanoma and histology, and discussing prognosis with the patient, which one of the following features is the most important prognostic indicator. So here is asking most important, which one of the following features is the most important prognostic indicator, which indicates the, on the basis of that we can decide the prognosis of this lesion. So options are the site of the lesion on the body, option B is the width of the lesion, option C is the color of the lesion, option D is the thickness of the lesion, option E is the history of bleeding. So here answer is the thickness of the lesion. You have to keep in mind that thickness of the lesion is the correct answer. Our next image, as I already showed you in the previous video, the 70 years old man whose photograph is shown has had the painless lesion shown on his lower lip for the last 6 months, and it is slowly increasing in size. Which one of the following the most likely? Again, giving the picture, asking about the diagnosis is very easier. If you have gone through this picture, you will give the diagnosis. I would give you that 100% you will give the correct answer because you have seen this picture before in my previous video. So here asking the diagnosis. Because of these pictures, if you go through these pictures, you will save your time in the exam because time is very precious during the exam. So here correct answer, what you will give, option A is herpes zoster, option B is herpes simplex, option C is squamous cell carcinoma, option D is the basal cell carcinoma, option E is the malignant melanoma. So correct answer is squamous cell carcinoma, yes, squamous cell carcinoma. We already discussed in the last video. So our next question is very easy to go through all these questions. Once you have seen, have you watched the previous video? Have you watched if you have watched the previous pictures and images, definitely you will give the correct answer. So our next question is 51-year-old man sustained a burn in a house fire, which he ran back into a burning room to bring out his daughter. The room was full of acid smoke from burning clothing. He was burned on his face, trunk, and arms, and the burns were judged partial thickness involving 30% of the total body surface area. He speaks in a husky whisper, and here's a signing of his hairs and eyebrows. Which one of the following actions should be undertaken first? So the options are insertion of intravenous catheter, option B is endotracheal intubation, option C is a silver sulfadiazine dressing to the burn area, option D is administering systemic antibiotics, option E a bolus dose of opioid. So from here, from this scenario, you can understand this is the acid smoke burn, and though the body area, surface areas 30% have been burned, but as you can see that he speaks in a husky whisper, so it means this injury is causing respiratory distress. So we will choose the option that first we have to go with the airway, breathing, circulation, ABC we have to follow. So endotracheal intubation will be the first option we have to take. So correct answer is endotracheal intubation. Our next question, a 45-year-old man present with a history of multiple subcutaneous lumps. She has noted them for many years. They do not bother her unduly, but are occasionally painful. On examination, she has a multiple discrete focal lumps beneath the skin surfaces of various sizes up to 3 cm diameter, which are soft and lobulated. Some are mildly tender. She has about 20 in all, which are situated bilaterally in the upper and lower limbs and on the trunk. There are no associated skin lesion, and she has been otherwise in a good general health. She can remember her mother having had some similar lumps removed. Which one of the following most likely diagnosed? So here they have given the multiple lumps she had, and her mother has had also the same issue. So here is asking about the diagnosis: neurofibromatosis type 1, adiposis dolorosa, or Duchenne disease. Option C is a multiple symmetrical subcutaneous lipoma. Option D is a multiple desmoid tumors. Option E is multiple epidermoids. So here they have not given the image, not given the picture, but the diagnosis is multiple symmetrical subcutaneous lipomas. So these are the lipomas. And our next question is 18-year-old youth present with changes shown in the photograph. The condition has been present for many weeks and is the sixth acute episode he had suffered over the previous 3 months. Which one of the following would be the most effective treatment to offer the patient? So here, this picture already we have discussed in my previous video. So options are regular salt water bathing of the toe, application of an antiseptic dressing to the edge of the toenail, option C, long-term antibiotic therapy, option D, wage resection of the affected region, and option E is a phenol injection into the affected area. So we already discussed in the previous video that this is the case of ingrowing nail. So here we will go with the wage resection of the affected region. So this is my last slide. Wage resection answer, correct answer is the wage resection of the affected region. So I hope you will go through this, and these all pictures and these discussion will be helpful in your exam. Thank you very much.